Generalized anxiety disorder, or GAD, affects millions of people every day, making even the simplest tasks feel overwhelming. But here's the good news. It's treatable. In this video, I'm going to walk you through how I approach treating generalized anxiety disorder, step by step, with particular focus on medication management. The first step in treating generalized anxiety disorder is understanding it. This begins with a thorough assessment. I focus on understanding the symptoms: excessive worry, restlessness, difficulty concentrating, feeling fatigued, irritable, muscle tension, and difficulty sleeping. It's important to differentiate generalized anxiety from other anxiety disorders or medical conditions. Objective rating scales such as the Generalized Anxiety Disorder Scale, also called GAD-7, are often used to quantify the severity of anxiety and monitor progress over time. But the assessment is just the start. Next comes building the treatment plan tailored to the individual's needs. Once the assessment is complete, I believe in educating my patients about GAD. Understanding what they're experiencing and why can be incredibly empowering. We discuss how anxiety works, its triggers, and how it affects the body and mind. But knowledge alone isn't enough. We need to translate this understanding into actionable steps. Cognitive behavioral therapy, also known as CBT, is recommended first for generalized anxiety. This involves working with the patient to identify and challenge their negative thought patterns. We replace these with more balanced, realistic thoughts. Over time, this helps reduce the intensity and frequency of anxiety. Behavioral therapies, such as graded exposure and relaxation techniques, are also integral parts of CBT, especially in helping patients manage the physical symptoms of anxiety. But sometimes cognitive behavioral therapy is not enough, and medication is then considered. Now, let's talk in depth about medication. The choice of medication depends on several factors, including the severity of symptoms, patient history, and co-occurring conditions. Selective serotonin reuptake inhibitors, also called SSRIs, and serotonin norepinephrine reuptake inhibitors, or SNRIs, are typically the first-line medications for generalized anxiety. SSRIs like sertraline, also called Zoloft, and escitalopram, also known as Lexapro, work by increasing the levels of serotonin in the brain, which helps to stabilize the mood and reduce anxiety. SNRIs, such as venlafaxine, also known as Effexor, and duloxetine, also known as Cymbalta, have a similar effect, but also increase norepinephrine. Benzodiazepines such as lorazepam, also called Ativan, and clonazepam, also known as Klonopin, are another class of medications used to treat generalized anxiety. These are particularly effective in the short term, especially for acute severe anxiety episodes, like a panic attack. However, they are not recommended for long-term use due to the risk of dependency, memory problems, and car accidents. Buspirone, also known as Buspar, is another option, especially for patients who may not tolerate SSRIs or SNRIs well. Buspirone works as a partial agonist at a specific serotonin receptor called 5-HT1A. Its benefits are it does not cause side effects like sexual dysfunction or weight gain. Pregabalin, also known as Lyrica, is sometimes used off-label for generalized anxiety. It's particularly useful in patients with co-occurring conditions like fibromyalgia or neuropathic pain. It works to reduce anxiety as a calcium channel blocker. Hydroxyzine is an antihistamine, meaning it can be used to fight allergies, but it is also commonly used to help with anxiety and sleep. It can be used as needed or on a daily basis. Propranolol is a beta blocker that's used as a heart rate and blood pressure medication. And while it can be used for generalized anxiety, it's usually more effective when used on an as needed basis, more for performance anxiety, like when you have to give a presentation for work or for school. Two other medications that one might consider for severely treatment-resistant cases are quetiapine, also known as Seroquel, and clomipramine. Seroquel works on dopamine receptors as well as several serotonin receptors. Clomipramine is a tricyclic antidepressant that works by strongly increasing both norepinephrine and serotonin. While Seroquel and clomipramine are both very effective, they're usually saved for more treatment-resistant cases because they do come with more side effects. But medication is just one part of the treatment. Next, let's talk about lifestyle changes and support systems. I encourage lifestyle changes that can help manage anxiety. Regular exercise, mindfulness practices like meditation, and a healthy diet all contribute to overall well-being. Sleep hygiene is also critical, as poor sleep can exacerbate and make anxiety worse. These lifestyle changes are key, but support from others is just as important. I often involve the patient's support system in their treatment plan, as long as the patient agrees to that. Family and friends can provide essential encouragement and help the patient practice their new skills in real-world situations. But what happens if setbacks occur? Let's talk about long-term management. Generalized anxiety disorder is a chronic condition, which means long-term management is crucial. Regular follow-ups, ongoing cognitive behavioral therapy sessions, and lifestyle maintenance are all part of a sustained effort to keep anxiety at bay. Did you know that 20 to 30% of people with an anxiety disorder like generalized anxiety also suffer from depression? If you are one of those people, or if you're curious to learn about depression, head over to this video right here to learn all about how I treat major depressive disorder.